The medical moment today, we posted on our Facebook page for people to give us ideas on what they wanted to hear about for the medical moment. We got several responses, so that's kind of cool. And we're going to talk about collapsing trachea. All right, so what is it? Why does it happen? What can you do about it? Collapsing trachea most often occurs in small breed dogs as they get older. The trachea is the airway, right? The windpipes carrying air from the mouth, from the outside down into the lungs. And the way it works when animals breathe, air is not pushed into their lungs, air is pulled into their lungs. And what I mean by that is, as their chest gets bigger, negative pressure is created in their lungs, so air gets pulled from the outside down into their lungs. It's pushed out, but it's pulled in. Well, in order for that to work, the tube that allows the air to get from the outside into the lungs, the trachea, has to be somewhat rigid. Because if it's not rigid and you decrease the pressure, it collapses. So the way that the trachea is designed is it's a long tube that's made up of a series of rings, and each of the rings is made of cartilage, and it's shaped like a C, but it's upside down. It's like this inside the dog. And there's a whole bunch of them next to each other. And the space between the top of this cartilage ring is a membrane that doesn't have any extra support. And it turns out that little dogs, as they get older, sometimes this cartilage becomes floppy and it's no longer rigid. So that when they breathe, especially when they breathe fast or hard, the pressure drops and the trachea gets smaller because of the low pressure. And if it gets small enough, it can actually snap shut briefly, which makes them cough. And so when they cough, the first thing they do is they try to take another big breath, and then they cough again. And so little dogs who have collapsing trachea, the classic presentation is the doorbell rings, they jump up, they get excited, they run to the door, they go bark, 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 go, because their trachea is collapsing. Now, there are other causes for blocked airway. They're not as common, but anything that puts pressure on the trachea from the outside could look similar. So if a pet had a mass or a tumor that was pressing on their trachea, squishing it off, that could cause a similar obstruction. If they had actually inhaled something into their lungs that went down into their airway, that could also make them cough. So not every coughing dog has a collapsing trachea, but often little dogs, as they get older, who have a cough that occurs during exercise or excitement, it often is a collapsing trachea. And with physical exam and some x-rays, we can sort that out. So the obvious question is, what do you do about it? There is no simple way to fix a collapsing trachea. So what we generally do is we try to manage it medically first. And the first thing we try and do is help these dogs lose weight. Because if they're overweight, they can have fat impinging on their trachea from the outside. So getting them lean is a good first step. The second thing we do is we try to avoid episodes of excitement or exercise that's going to trigger these episodes. So we put a sign over the doorbell that says, "Don't ring the doorbell." Because believe it or not, something simple like that can make a difference for these little dogs that are at home all day, and people are pushing the doorbell, getting them ramped up into their routine. The next thing we do is we encourage those owners to have their pets wear a harness rather than a collar. Because if they have a collar on their neck, they run to the end of the leash, they choke themselves, that can trigger a cough, which can go into one of these coughing fits where they go over and over again. If that's not enough, then we can use medication that suppresses coughing and reduces inflammation. These airways, as they snap shut, the tissues are getting slacked from the inside. And as that tissue is irritated, it gets puffy and swollen. Well, you can imagine if a tube gets puffy and swollen, then the opening gets smaller, which makes it harder for them to breathe, which leads to more coughing. So one of the ways that we manage collapsing trachea is we use medication that reduces coughing and reduces inflammation. And there's a series of drugs that we can use to do that. Unfortunately, for some of these dogs, this is a progressive condition, and the cartilage gets weaker and weaker over time, which means their airway is more and more dynamic, so that even the things that we do physically to eliminate the coughing, the medication, sometimes it gets to a point where they're just coughing all the time. For those dogs, there is a surgical option. It is not a first choice procedure, but when we've tried everything else and the result is not sufficient, we can refer dogs to the specialist, and they can be evaluated to determine if a stent would be helpful. A stent is a medical device which goes inside the trachea. It's small when you put it in, and through some magic of how they're designed, they can expand, and then they hold the airway open from the inside. The catch is it's difficult to place. Sometimes they move, sometimes they break, and they're hard to take out. And so while there's a place for these, it's not a simple panacea, simple fix. So before any specialist would commit to placing a stent, they're going to do a careful evaluation to make sure it's going to actually benefit the patient and that the benefits outweigh the risks. So anyway, that's the scoop on collapsing trachea. Any questions? Great, thanks.